Good afternoon. So this is exercise 30, the lymphatic system, of course for BSC2086 Anatomy 2 lab. So what is the lymphatic system? Well, it's probably less famous than some of the other systems, the cardiovascular system, the digestive system, the respiratory system, stuff like that. But it is a very important system. And in fact, some books consider the lymphatic system to be part of or like a subset of the circulatory system. Some call it a separate system, but either way it works very closely with the circulatory system, and you can kind of think of it as its own mini circulatory system. So the circulatory system infamously travels blood throughout the body and travels other things through the blood by the blood vessels throughout the body, and the lymphatic system we're going to see has its own vessels, and it travels lymph throughout the body and things in the lymph throughout the body. So this is one definition. I think it's from your book, the network of vessels, tissues, and organs that recover fluid not reabsorbed by capillaries. And then it inspects this fluid for disease agents, so it's going to play a role in immunity. It activates general or specific responses to destroy these agents, again, immunity, and then return this fluid to the blood. So like I said, it's going to work very closely with the blood. When you were dissecting the pigs and you were looking for the different veins and arteries, that stuff that wasn't fat, it was kind of grainier than fat that you had to move out of the way, that seemed to be throughout the body and very nearby to the blood vessels. That was the lymph tissue. So the major functions of the lymphatic system are fluid recovery. So this is going to maintain the fluid balance within the body. It's going to maintain the blood volume, and by doing that, it's also going to maintain the blood pressure in your body. Again, it's going to play a very important role in immunity because it's circulating white blood cells, specifically lymphocytes, which was a type of the agranular white blood cells. And if you remember, there were B and T lymphocytes. And it has a role in lipid absorption. So there's these specialized things called lacteals in the villi of the small intestine. And if you remember, the villi are those things that kind of go up and down like that, and they look like little fur on the small intestine, and it's going to absorb nonpolar substances, i.e. lipids, and it's going to transport them back into the blood and the venous circulation. So what is this system made out of? Well, you've got lymph, which is the fluid stuff, so that's the equivalent of the blood. That's how things travel throughout the lymphatic system, is via the lymph. And sometimes you'll hear it called extracellular fluid or interstitial fluid, depending on whether it's inside or outside of the vessels. And then, of course, you have the vessels themselves, and there are lymphatic capillaries, and then you have those lacteals that were specialized for lipid absorption, which are only found in the small intestine. The capillaries are going to converge, in other words, come together, and you're going to have bigger vessels leading to smaller vessels, and then back again, just like the arteries and the veins are connected by capillaries through the circulatory system. The same is going to be true for the lymphatic system as well. You go from bigger to smaller and then smaller to bigger. You have some superficial vessels and some deep vessels because you want the ability to transport these white blood cells wherever the infection is, right? So if you have an infection in your skin, or if you have it deep, gosh forbid, in some organ, you want it to be able to get where these immune cells to be able to get wherever they need to go. You're going to find ducts in some of the parts of this system, and a duct is like an opening, right? So that's where the lymph fluid is going to drain out of the lymphatic system and return it to the venous circulation. So again, I can't stress enough, there's so much interaction between the two systems, the blood to the lymph and back again, of different cellular and acellular components. So just like any good system, there are organs, and there are two types of organs involved. There's the primary organs of the lymphatic system, of which there are only two, and then there's secondary. So the two primary lymphatic organs are the bone marrow and the thymus. All blood cells originate or are born in the bone marrow. But the reason that you have two different types of lymphocytes, named B lymphocytes and T lymphocytes, is because it has to do with where these cells grew up. So if you were born in the bone marrow and you stayed there and went to primary school, in the bone marrow, then you would be B lymphocytes, and those are the ones that are going to produce antibodies, right? If you were born in the bone marrow and then you moved to the thymus and that's where you got your education and grew up, then you're going to be a T cell. So you also have secondary lymphatic organs. So once these guys that grew up in the bone marrow or in the thymus have matured and they've graduated, they're going to go off and they're going to live in these other little organs and wait around until they're needed. So until there's some kind of invasion or infection in the body and they're needed to be recruited to combat that infection. So I had a student tell me once that they remember the secondary organs as being the things that swell or get sore during times of infection. And not only did I think that was a great way to remember them, but I also think, but it's also really logical too, if you think about it, because that's exactly what's going to happen, right? So these are things like the spleen, tonsils, lymph nodes, nodules, and also the MALT, which we're going to talk about shortly. Far and away, the largest lymphatic organ that you have is the spleen. And we already talked about the spleen in the context of how it recycles red blood cells. So it chews up the old ones so that you can produce new ones. And that's going to occur in a part of the spleen called the red pulp, and that is because it definitely does look reddish if you look at it either in this picture or under the microscope. But then you'll notice that there are also lighter whitish sections. And you might guess that if red blood cells are found in the red pulp section, then the white blood cells are probably found in the white pulp section, and you would be absolutely correct. Okay, so we all know our tonsils are in the back of our throat. If we've ever had an infection, a childhood tonsillitis, anything like that, they probably got swollen and uncomfortable and you had a hard time swallowing. So we actually have 3 sets of tonsils. Pharyngeal are going to be near your pharynx, and if you remember, your pharynx is just a fancy anatomy way of saying throat. And then the palatine ones, so the palatine bone from skull anatomy was that bone on the roof of your mouth, and that's exactly where those are. And then lingual is a word that refers to tongue, so those are going to be the ones that are just there underneath your tongue. But you also have lymph nodes throughout your body, right? If you've ever gotten scratched by a stray cat or something like that, and the area around the scratch got infected and got swollen, and you felt like little knots under there, that was because the local lymph nodes were swollen. So you've got them in places like your armpit, which we call axillary, in your groin area, which we call inguinal, in your neck area, which we call cervical, and then I think we all know thoracic, abdominal, intestinal, which has another name as well called mesenteric, and then popliteal is that cool word that we use to describe the back of your knee. So this is what a lymph node looks like if you examine it. You've got afferent and efferent vessels that are bringing things in and then taking them away. The hilum is this area right here, and it's literally named that because it looks like a hill. Hilum means hill. And then the capsule, just like in general, the word capsule means that outside covering, and that's going to be the area that's around the lymph node. So some specific lymphatic nodules are the Peyer's patches in the small intestine, and if you were able to see these on the microscope, you'll notice that they're diffuse or spread out lymphatic tissue, so they have that different sort of grainy appearance to them, but they have little or no capsule to them. So anybody who's taken micro would know that the place of the most pathogen invasion, so when bacteria and viruses enter your body, oftentimes they do so through the mucous tissue. And this is because it's really hard to penetrate skin. You know, our skin does something other than just make us look nice, make us not look like a walking skeleton with muscles stuck to it, right? It also protects us, and it does a really good job of that. It's really hard for things to get inside of intact skin. Broken skin, that's one thing, but intact skin, it's really hard. So most things get in through our mucous membranes. And if you remember, mucous membranes are the kinds of tissue that line any cavity that is exposed to the external environment. So like your respiratory system, your digestive system, your urinary and reproductive systems have holes that lead to the outside world, right? So they have a mucous membrane, and they have the ability to ingest or take in pathogens and viruses when they feel infected. So MALT or MALT is mucosa-associated lymphoid tissue. So if we know that those are areas that are commonly exposed to infections, then it would be important for us to have some kind of layer to protect us from those infections, so that if they do happen to get into there, they can be destroyed, hopefully before they cause a problem. And that's what the function of this tissue is. Okay, so that's it for this chapter.